It's also very competitive in the sense of the hospitals want to have as much patients as possible. So there has to also be a negotiation that goes on between what hospitals are going to accept what insurance. And there's a lot more hospitals than there is technically insurance providers. So the hospitals want to fight for as much patients as they can, and the insurance has to come to agreement with the hospital to then allow their insured people to come to the hospital. So that's a really big negotiation as well on how can the hospital be able to jump on the insurance's terms so that the insurance is going to approve this hospital, which then gives the hospital patients. So it's like a fine balance of how much can the hospitals charge to then satisfy the insurance. So then the insurance agrees with the hospital and then sends them patients, because the hospital has to make money off the procedures, but it also needs patients. And for both those to happen, they need the insurance approval. Because if this insurance does not want to go to this hospital, well, then the hospital is going to have to find patients somewhere else. They're going to have to go to a different insurance provider. So there's a competition between the insurances to see what hospital they want to join, and there's a competition with hospitals on what insurance they want to take on. So that just makes things even more competitive. It makes things even more complicated, because without hospitals, insurance is pointless. Without insurance, hospitals don't have money and don't have patients. Hospitals also do get the Medicare, Medicaid kind of stuff, the government provided finances, but you can't just have a hospital that is going to take government money. They're going to be very limited. They need some kind of other private healthcare sector insurance providers to be able to also join that hospital.